19 elderly people, many of whom no longer have families, are cared for by devotees at the St. Vincent de Paul Center in Zove in Nyarugenge district. As the world and Rwanda continue to face the COVID-19 pandemic, the elderly over the age of 70 say they've learned about the pandemic and are taking steps to protect themselves against it. The person who is infected fails to breathe, and so people like us, when we get infected, we can lose our lives. While here, we wash our hands with water and soap, we wear face masks, and we avoid shaking hands. We instead wave. There are some people that develop flu first, and then after high fever. Whoever feels that way seeks treatment. The other thing is that it affects the elderly different, so we put a lot of emphasis on hand hygiene and wearing face masks so that we don't get the virus or even spread it. In addition to the elderly in private care facilities, even those that still stay in their homes say they've come up with strategies to avoid COVID-19. We got face masks, and we avoid going to places where people are not wearing them. Those that don't have them are reminded to buy the face masks. The measures we took are paying off as they continue to protect our lives. Theodora Uwimana, the director of the St. Vincent de Paul Center, says some of the measures taken to protect the residents of the center include preventing them from encountering people on the outside in order to prevent the spread of the pandemic, even though it has changed the capacity of the center. We used to be aided by well-wishers who would come visit us and help us with supplies and food. When the pandemic hit, no one is allowed to enter here. So this became a challenge, and this made changes in how we care for the people that are under our care. But we have enlightened them that when the pandemic subsidizes, things will change. The United Nations says that although all classes of people can be infected with COVID-19, the elderly are said to be at the highest risk of complications and even death. According to the United Nations, 66% of those over the age of 70 have at least one of the non-communicable diseases or an infectious disease, which increases the risk of death from COVID-19, according to the UN Secretary General Antonio Guterres. According to the United Nations, between 2019 and 2030, the number of adults over the age of 60 is expected to increase by 38%, from 1 billion to 1.4 billion people.